Good afternoon, everyone, and welcome to today's webinar, Communities Talk about Engaging Colleges and Universities in Prevention. Today's webinar will be recorded. And my name is Captain Chris Jones. I'm the director of the Center for Substance Abuse Prevention at SAMHSA. I'm going to be your host and moderator for today's webinar. And we're joined by 4 Communities Talk organizers from across the country to hear about the amazing work that they're doing and sharing their prevention stories. So really excited for you all to be able to hear about their innovations and efforts in just a little bit. We'll also be taking questions from the audience for our speakers. So please use the Q&A section of the webinar in order to register your questions. So what is Communities Talk? Let me just give you a little bit of background, but also underscore why this is important and why we're focusing on strategies for prevention for colleges and university students. As many of you may know, SAMHSA releases National Survey on Drug Use and Health data every year. And just a couple of months ago, we released the most recent 2023 NISDA data that provides really a snapshot of alcohol, substance use, and mental health among people 12 and older. And what we consistently see in the NISDA data is that people age 18 to 25, so those key college year time periods, are those that have the highest prevalence of substance use. And just 2 data points, I think, underscore the importance of prevention among the higher education community. So among 18 to 25-year-olds, 27%, so that's a little bit more than 1 in 4, had a past year substance use disorder, and about 15% had an alcohol use disorder in the past year. And again, these data really underscore the need for a local level focus on substance use prevention. And SAMHSA's investment in Communities Talk has helped bring together youth, young adults, prevention professionals, community leaders, schools, family members, friends, and other influencers in their communities to come up with local solutions for their substance use challenges. And Communities Talk is really part of a larger prevention framework that we are moving forward at CSAP and at SAMHSA. And as you'll hear today, it's just one of those critical pieces of helping jumpstart conversations in communities. Communities Talk is run by SAMHSA with really the goal of supporting community-based organizations, institutions of higher education, and statewide or state-based organizations in holding events around substance use prevention or substance use prevention activities. These events are aimed at raising awareness and educating communities about the consequences of substance use, as well as underage drinking and excessive drinking in youth and young adults. It also encourages communities to mobilize and to come together to take evidence-informed prevention actions. The good news for all of you that this is really our kickoff webinar. So the next cycle of Communities Talk officially launches in January of 2025. And to better support communities in their prevention efforts, under Communities Talk, SAMHSA offers a $750 planning stipend. And these stipends are issued on a first-come, first-served basis. So we encourage organizations and colleges or universities to participate in Communities Talk and to continue their prevention work, even if they don't receive a planning stipend. But certainly, because these are first-come, first-served basis, and we're kicking off soon, now is the opportunity to get ready to put your name forward for the stipend. So a little bit more specifically on Communities Talk for 2025, the first step, if you're interested in engaging and interested in the stipend, is to request an invitation. You can see on this slide here where you would get the email invitation from info@communities-talk.com. And for those of you who have been part of this in the past, please know that this is a new email address for this year. So make sure to update it in your contacts and flag it for future reference. If you have been a past Communities Talk participant, you'll automatically receive an invitation. And once you've been invited, you'll want to complete your online registration so you're able to apply for the planning stipend. And after registration, of course, you can start planning your prevention activity. We also have a hashtag Communities Talk that you can follow on social media for the latest updates and news. And we have a planning toolkit that will help you begin organizing a prevention activity in your community. And you can see the email there as well. And of course, you can visit the SAMHSA website for Communities Talk, which is in the last bullet on this slide, for tips and resources and to read about some of the actions and activities that past folks have done under the Communities Talk prevention stories. And in addition to Communities Talk, we do want to flag a number of other prevention tools and resources for colleges and universities specifically. Some of the SAMHSA resources include a webinar series for prevention professionals that's available on SAMHSA's YouTube channel. It covers a wide variety of topics, including fentanyl overdose prevention, intersectionality to advanced prevention, and storytelling, as well as specific SAMHSA webpage focused on prevention resources for youth and college students. Our partners at the Drug Enforcement Administration also have a number of important higher education resources, including the Prevention with Purpose Planning Guide for preventing drug misuse among college students, and a podcast series with guests at the federal, national, state, and local level talking about substance use prevention among college students. In addition, our colleagues from the National Institutes of Health, in particular, the National Institute of Alcohol and Alcohol Abuse, called the College Aim Alcohol Intervention Matrix, and the National Institute on Drug Abuse, or NIDA's College Age and Young Adult webpage with data and resources for college age adults. But you didn't hear me come to this webinar to hear me talk. So really what we're here to do is learn from those communities that have engaged in the Communities Talk activities. So we have 4 different perspectives that will be shared during the webinar today. We'll start with Jessica to get us started. But as I mentioned before, if you have questions and answers, make sure you're putting those in the Q&A box in the chat or in the webinar. All right, Jessica, over to you.
All right. Hello, everyone. My name is Jessica Ulrich, and I am the Practicum Education Director for the Department of Social Work at Southern Illinois University, Edwardsville. And so this is my 2nd time doing the Communities Talk. And so this year I collaborated with SIUE's EOA and Title IX office, because October is both Domestic Violence Awareness Month as well as Substance Abuse Awareness Month. And so we thought that it would be powerful to integrate both disciplines to have a multi-pronged approach. And so what we did is we hosted a wellness fair. And so this was a campus fair that was in the student quad area that focused on domestic violence as well as substance use awareness. And so we integrated both of these issues to try to help students to understand how they're both interconnected, to have more of a holistic view and support. And so we had different student organizations, as well as off-campus entities, agencies, some focused on interpartner violence, some focused on substance misuse, just mental health treatment. And so some of the booths that we had several alcohol and marijuana impairment vision goggles that we would have different activities for students to participate in. And so some of the activities were maybe playing Connect 4 and recognizing how the impairment goggles definitely interfered with your cognitive judgment, all of that. We also had a driving simulation activity. We had different kinds of mazes. And then some of our community partners brought things like Narcan, as well as some testing strips in an effort to do some harm reduction. And so we had Narcan demonstration, and students were able to take Narcan and the testing strips with them whenever they were leaving too. We also partnered with our police department. And so we had out on the quad a police car that we had individuals putting Post-it notes with encouraging messages to both domestic violence survivors as well as individuals who are struggling with substance misuse. And so we called it Cover the Cruiser. And so students would walk by and put encouraging messages on the cruiser outside as well. So it attracted a lot of interest. We had activities that outside as well as inside in the quad as well. And so the primary focus or the audience that we had were the students on campus. There were some faculty and staff that passed through as well. Main topics were alcohol, substance misuse, mental health. We had myths and facts. We did have some focus on domestic violence awareness as well. Different fraternities, sorority life, different student organizations volunteered to help host some of the tables and activities as well. And so we also had the local community members as well. And when we talk about the impact of the community's talk participation on the campus community, I think that it did a really good job of talking about the reduction of prevalence of alcohol and other substance use in the community. I think a lot of students really, by participating, using the impairment goggles, I think that it helped them to fully understand how their judgment can be impaired. And I think it got people talking, so definitely creating an ongoing conversation about alcohol substance use prevention in the community. And we did a lot of collaboration between both on-campus partnerships as well as off-campus partnerships for continued alcohol and substance use prevention activities. So that's an overview of what we did. I will pass it off to the next community and invite Dr. Wilson to speak as well.
Dr. Wilson, you're on mute.
Okay, good afternoon, and thank you for inviting Texas Southern University once again to talk about our activity for the Communities Talk program. So I am Dr. Deborah Wilson. I'm an assistant professor in the Department of Counseling at Texas Southern University, where we prepare and train master's and doctoral level students who are journeying into the field of counseling. Within the department, we have 2 student organizations, and we encourage them to engage in the community and around campus to address some of the issues that are plaguing our community. For instance, from 2019 until 2003, Texas has been dealing with a fentanyl crisis. When we received our stipend this year, we said, what are we gonna do? The students collaborated. Now, mind you, this is our 3rd year with a grant, so we've cycled. We started at the university, then we held an event in the community. The event was so successful in the community as far as fentanyl awareness that we decided to bring it back to campus this year. The students did a wonderful job. It was a big success. So I thought I would invite one of our students to talk about the event that we had. We held a town hall, and I want to hand it over to Kelsey so that she can talk about the event. You're on mute. Kelsey. Almost. Are you okay? No? Okay, so I'll go ahead and talk about the event. So the students in the Department of Counseling hosted the Communities Talk event. So the TSU Counseling Association and Chi Sigma Iota got together and said, okay. it was
Dr.
so
Wilson?
successful. Are you there?
Yes, ma'am. Apologies for the technical difficulties. Thank
Okay.
you, Dr. Wilson. I definitely can take it from here and speak on behalf of Texas Southern University
Okay,
and
very
the
good.
counseling organizations and the event that we held on campus. Texas Southern University's counseling organizations and Chi Sigma Iota, Tau Sigma Epsilon chapter recently hosted a powerful town hall addressing the fentanyl crisis and substance misuse. Building on the success of previous events, the session gathered over 100 students on the TSU campus to discuss alcohol and substance misuse, abuse, and mental health awareness. The event featured Travis's Voice, a nonprofit founded by Janice Stahl, a mother who turned the devastating loss of her son Travis to an accidental fentanyl overdose into a mission to save lives. With raw emotion, she recounted how her life was forever changed, urging attendees to recognize the dangers of fentanyl and its rippling effects on families and communities. Her story served as both a warning and call to action, inspiring attendees to confront these issues head on. Here are some event highlights. The president of the TSU Counseling Association drew on his experience as a school counselor and highlighted the impact of alcohol misuse on young people's mental health and success. His relatable perspective as a professional and peer leader encouraged students to make informed decisions. Another highlight was the founder of Travis's Voice, who shared her emotional testimony and critical insights into the dangers of both alcohol and fentanyl misuse, creating a well-rounded discussion. Why does this matter? Fentanyl is ravaging Texas communities, especially in Harris and surrounding counties. Young people aged 15 to 24 are most at risk. Substance misuse undermines mental health, academic success, and future opportunities. The town hall deeply resonated with attendees, many of whom became emotional, they asked thoughtful questions, and they stayed afterwards for more engagement. Faculty and administrators also joined the discussion, reinforcing Texas Southern University's collective commitment to addressing this urgent issue. TSU counseling organizations remain dedicated to raise awareness, provide resources, and empower students to make meaningful actions on substance misuse. Together, we are protecting our communities and paving a pathway forward. Dr. Wilson, is there anything else that you'd like to add on behalf of the university?
Not at this time. We'll pass to the next.
Thank you.
Okay.
Thank you, Dr. Wilson. Linda Thompson. I'm with the Greater Spokane Substance Abuse Council and our Greater Spokane Community Safety Initiative. As Travis's mom, I am a mom who lost my 3-year-old son to a 17-time repeat impaired driver 38 years ago. I went from banking into prevention because I knew we had to make a difference for saving lives and making it hard for other families to not have to go through this. So I have been with GSAC, Greater Spokane Substance Abuse Council, for 32 years and worked on this, have had several of our Communities that Talk events, but this year was an incredible opportunity that I got to work with students from Washington State University, and I'd like to hand it over to Isaiah David to talk about the event.
Thank you, Linda. My name is Isaiah David. I'm a PR senior at WSU, Washington State University. And I'm originally from Vancouver, Washington, but going to school in Pullman. So about our event, me and a few of my classmates, Brandon Fontaine and Carlos Romero, wanted to work on substance abuse and alcohol use prevention. And we really wanted to focus on when people are driving, because we noticed that on our campus, this was a big issue that we were noticing among our peers. And we also noticed that in Pullman, which is where our college is located, DUI numbers were increasing. So what we did was we hosted a town hall style meeting where Linda gave a really powerful story about how she lost a loved one to impaired driving. And so we really thought that this was a powerful tool that created a lot of discussion among students. And also it was a really emotional thing. So some of the topics that we covered were alcohol and substance use, as well as mental health. We worked on communication campaigns and strategies, cost to society and local community for underage drinking and driving. We wanted people to think about not only the monetary costs that are associated with it, but also the mental costs that are, then also parental involvement in prevention. Throughout our event, it was really important for us to work with on-campus and local community partners. So we worked with our local Target Zero manager, John Griffin. We worked with Cougs for Recovery, which is an on-campus based recovery group. And we also worked with the Center for Fraternity and Sorority Life, which is an important collaborator because it helped draw people to our event that are a part of Greek life on our campus. And we also work with Cougar Health Services, which was our on-campus health people. And then it was just really important for us. We gave out local on-campus and then as well as community resources for people to have who to call and those sorts of things to try to prevent impaired driving on our campus. If you could go to the next slide, please. And so this was the poster that we had for our event, Coug Saving Lives Together. The main message of our campaign was call, plan ahead, and save lives. So we really want people, if they took one thing away from our town hall, we really wanted them to think call, plan ahead, and save lives. And our event was hosted right before going into Thanksgiving and winter break, which can be a time where we see an increase in DUIs. So we just really wanted to hammer home this point to our fellow students.
So I'll jump in here. You can see what a powerful event this was, led by the students. I just was so taken by their passion. And what happened is we were having this discussion, and one of the students in attendance was very emotional, very teary. And it ended up that she had lost a sister recently from a fentanyl overdose. And so Isaiah and Brandon and Carlos moved our discussion to grief, to mental health, to talking about being compassionate for one another and to watch out for fellow Cougars, because it's going to take all of us to make change with this. And I thought that was an incredible movement by these young students. I mean, they're young to me. I'm an old woman, but they were young and they were so compassionate for one another. And I felt that that was one of the key things that came out of this event, was to start to talk about reducing that stigma of needing to call 988 for mental health help, reaching out, making sure folks use the Cougar Wellness Center. I thought they did an excellent job. The other thing I wanted to point out to folks is that these are young people who, all three of the students were seniors about to graduate and go out into the community. Isaiah is hoping to work in government, local government, state government. He's got a real passion for making a difference in municipalities. He will be able to take this messaging and this understanding of what affects public safety and community safety into a job that he goes into. Brandon is going to go work in a family business and will be able to be part of their Chamber of Commerce and representing their family business in the business community. And again, raising awareness of the policies we can put in place, like making sure we always have designated drivers if there's alcohol at a chamber event, making sure that businesses think about having treatment and recovery services included. And then Carlos is going to work with youth in communities. His hope is to work in community and help young people make good decisions. So even though the event was really focused on right now education and making change, the future of these young leaders is going to make a huge difference in our communities. And I'm just proud to be part of what we did and so proud of our Cougars. So Isaiah, anything else you want to add before I introduce our next speaker?
I think you nailed it. And I just want to give a huge shout out to Linda and the Greater Spokane Substance Abuse Council for their partnership. It was an incredible event, and I hope that we can continue your partnership with WSU in the future. So thank you.
Go Cougs. Okay. We're going to turn this on over now to Dr. Siriaga.
Hi, good afternoon. This is Armiel Sariaga. I'm the assistant professor at the Christian Healing College of Nursing at the Florida Atlantic University. This is our third year participating in the Communities Talk by SAMHSA. So we're very grateful about the opportunities. And I wish my students would be here to present this event, our project, but they're off school now, so I understand. So for this year, we had different events. We have one poster presentations that we collaborate with our local Sigma chapter, our Sigma Ethos at large chapter with the Broward College and the Florida Atlantic University, as well as we have a town hall dialogue or town hall event with our nursing students. So our community's talk is centered on the preventions of underage drinking, as well as a college population drinking in terms of alcohol and its interactions with other drugs and or substances. So we have a group of students that join our team and also some of our faculties and staff. And we have a banner that we promote this event. We also invited the mayor of Boca Raton to join us, so to increase our visibility and also our the awareness in public about the harms and dangers of underage drinking, as well as drinking among college age population or students. So we use the data from the Florida Department of Law Enforcement to make this event more meaningful for the students, that hey, we have this harms that are affecting our communities, especially here in Palm Beach County, Broward County, as well as Miami-Dade. So for this year, we have a poster presentations during our local Sigma Research Day, and our students are the one presenting it, answering questions with other students, with other staff, with faculty, and also they conducted a town hall with the students, an open dialogue about the effect of alcohol, binge drinking, for example, with their peers or with other friends, right? So then we presented the data that we analyzed from that data set, that nearly 300 people, 300 underage population died from alcohol-related mortality here in Florida between 2020 to 2021, and nearly 800 college-age populations are being affected with alcohol-related mortality. So that gives the message to them about the impact of alcohol drinking to our college population, as well as those underage populations like 14 to 20 years old. So we have this event, and our students entertain questions from the audience, from their peers, about their experiences as well. So they shared that one, and it was a very interactive event. And we promote that one with also with our public health, public relations committee here at the university. So we promote this with a banner, and we have increased participation. And last year we did a community talk with our community center, as well as the library or other professional organizations like the National Alliance with Mental Illness. We invited us for their talk, but we focus more of the college population because that's where the effect of the alcohol mostly. So I think it honed the message that with alcohol, it only create a lot of health-related outcomes issue, like cirrhosis of the liver. We have that discussions with the students, and we exchange our experiences caring for them in the hospital because we are nurses and our students are being trained how to care for patients with alcohol-related issues, right? So with this early exposure to issues that affect their health as well as their potential or prospective patients, then they have this what you call this insight of how they handle and how they are caring for this type of population in the community. So if you have any questions, we can share our other alternatives because we are not only focusing on alcohol, we're also focusing on marijuana or cannabis, and we publish that, and other substances like kratom or metrogenin, and also with opioids. And with our publications, it gathers a lot of attention, like more than 12 media outlets carried over the publications on cannabis, for example. Now we tied in with alcohol and the effect of alcohol with other substances or the polysubstance use. So our students have this enhanced competency on how to care for patients and identifying people at risk, especially among their peers. So that's the main focus of our presentations and town hall meeting for this community talk for this 2024. With that said, if you have any questions later on, we are here, and I hand up to Captain Jones if you have any questions.
Great. Thank you so much, and thank you to all four of our presenters. I love the diversity. You're all working within a higher education setting, but you're focusing on different segments. You're working with Greek life. You're working with health, future health professions, looking at peer models. So just really appreciate the diversity, and I think that's sort of the beauty of Communities Talk is that you really can build something that is, sort of leveraging key components of the educational community that are relevant to your local context. So just really appreciate the experiences that were shared. We do have several questions that have come in. I just want to re-up a few that have been answered already. One, yes, slides will be shared. Recording of the webinar will be on SAMHSA's YouTube page. And that while today's discussion is focused on higher education, colleges and universities, the stipends in the 2025 cycle will not exclusively focus on that. It really can focus on substance use among youth as well as adults. That was answered in the chat, but just wanted to underscore that. But we wanted to take the opportunity today to talk about some of the examples that have happened in the higher education space. Because there are some unique things that you might want to consider if you are interested in doing that, and we wanted to have those experiences shared. So let me get to a couple of the questions. Some of these are specific for some of the presenters and some of them are more generic. So for the first one, this is for the Texas. Was there a specific call to action for the students or leaders? Did individuals learn what they could do to help going forward when the town hall ended? And did you track their further engagement? So sort of a three-part question. Oh, you're on mute, Dr. Wilson. Yeah, there you go.
Okay, so the purpose of it was, of course, to engage our graduate and doctoral students in real world challenges that they will be dealing with as they journey into the field of clinical mental health counseling. The other is that we have these pressing issues in the community that spill over into or onto the college campus, and that is what's going on with drugs and alcohol, which is having a tremendous impact on the 15 to 24 population out there. And of course, our population is anywhere from 17 to 24 years old. So it gives, one of the things that I really liked about it was that the organizations put it together. And the students who attended had a chance to interact with their peers in addressing this issue, which for some, and we know that our students are dealing with this because during the event, there was a question, how many people are impacted or know somebody who has a drug issue, alcohol issue, and all hands went up. Again, as Kelsey mentioned, it was very emotional. It gave them a opportunity to interact with peers in discussing, excuse me, in discussing the issue. And it also gave the students and the university a chance to collaborate with outside organizations that are working to address the issues that are bigger than any of us. And again, fentanyl is a crisis in Texas, and Harris County being one of the largest counties in Texas is severely impacted. For instance, from 2019 to 2025, the increase is horrendous. Went from 90 accidental or unintentional deaths from fentanyl and other synthetic opioids to 512 in 2023. And so we were able to discuss the impact of substance abuse. We were able to talk to the students about being conscious about their surroundings and who they're interacting with and what they're putting in their bodies, because you don't know what's going on out there. And a highlight of the program was that the nonprofit organization, Travis's Voice, and Janice Stahl, his mom, who made it her mission to bring about fentanyl awareness, brought with her 300 play cards with pictures with names and ages that ranged from anywhere from 2 months to 80 years old of individuals who were impacted by fentanyl. So everybody that walked in that space and in there were impacted by it. We did this in the community initially, and it was such a success with that age group, the 15 to 24, and their parents, that we decided to bring it back on campus. Thanks to the SAMHSA Communities Talk grant, we were able to bring it back on campus so that we could bring that awareness on college campuses. And we emphasized to them, if you see something, say something. There were demonstrations with Narcan. They learned what to do if something happened, what not to do, what to be aware of. And more importantly, some of the agencies or organizations and the counseling center on campus, who to go to if they're experiencing something, and contacts or anonymous contacts in the community that they can get in touch with if they're experiencing something. But most of all, that they're not alone in the struggle if they're having issues, or if they're impacted by family, the family issue, because it's a problem that's bigger than all of us. We also talk to them about laws related to the use of, say, marijuana or CBD and things like that, because a lot of times students are engaged in cannabis and it's not legal in Texas, right? And they'll say, okay, but it's not legal here. You got to be careful, and how it can impact you as a student who is striving to become a productive person in society. So our Communities Talk event, over the 3 years that we've done it, has impacted our students that are matriculating through the program, the students on campus who might be dealing with something or unaware of the impact of alcohol and drugs, about the crisis that we're involved in, and what they can do if they're impacted by it. So this grant was, or the community's grant that we've had over the years, has been really instrumental in us getting the message out.
Yeah, thank you so much. And I appreciate that. Really what comes through in all of the presentations, and you sort of underscored this in what you were just sharing, really two things. One is that institutes of higher education are more than places where people go learn. They are an integrated part of the community, and can be voices to change norms in communities and set those norms. And I think each of you are doing that through your work that you've been talking about. The other part is really sort of those personal stories. As you mentioned, 300 names, faces, people, the human touch behind the statistics. And Linda talked about her own experience. And I met Linda back in October at Washington State. And it's just one of those things where that really connects you to why we're doing what we're doing. And you don't forget those names and faces. And it is really what drives our mission. And I think those are important parts. It's easy to forget some of the specific words that might be shared in a town hall, but you'll remember how you felt. You remember why you were there and what you were motivated to do leaving that. Because we know a single town hall is not going to address a very complex issue, but that it can spur further action, further collaboration, further engagement across the community to affect much broader change. So let me ask a question, and this is really for everybody. Maybe we'll go in reverse order from the presenters. It will be a test from our presenters to figure out if you can do that. But just a general question, did you encounter any pushback from your college or university in regard to implementing your event? And then how much time would a group need to plan in advance to sort of accompany potential pushback?
I can answer on our end. Sometimes there's like a pushback, but it's not really a pushback, just like to have some sort of understanding about where your priority is. For example, when you are in tenure track, of course, you're focused more on research and productivity and publications. And then when you have this community's event, but we try to convince that this is part of the research. This is part of why we do things to benefit the community and to save lives and to prevent, and part of our harm reduction program and prevention applications. So it's part of our research, and not only because we're trying to educate among scholars or share or add knowledge or new generalizable knowledge, but also we want our youth, our students to participate and engage in this endeavor, because this is for them and to save their peers' lives and to have a brighter future, because they are nursing students. Of course, they have a brighter future, but they're caring for other people, for other adolescents who are engaged in binge drinking, who have effect as early as they already have alcohol use disorders, or even like cirrhosis of the liver diagnosis early on. So it has a health impact on them. On a daily basis, we encounter people having some issues with driving. And you hear that from other presenters, right? So the impact, the students can also we feel that they are part of the group. They are part of the greater good, that they are doing something for the community, and that's what makes them happy. So after this, they reach out to us. Can I join your future research? Can I join your future event? Or can you join your other initiatives in there? So their initiative spreads out to other students, which is more contagious, but contagious in the sense that they're helping to reduce the harms brought about by binge drinking or misuse of substances like alcohol or cannabis.
David, Isaiah, do you want to go next?
Yeah, I can talk a little bit about at Washington State. I think our university gave us a lot of support from like our professors and our department, and then as well as like other students, and then kind of the community organizations we worked with on campus and also off campus gave us a lot of support. I would say as far as like planning the event, we started working with Linda at the beginning of September, and we didn't host our event until the middle of November. So I thought it was important to have that kind of time to kind of develop those relationships with our community partners, and then also just do all the planning that goes into hosting an event like that, and then also just marketing the event to make sure people actually show up to the event.
And I would like to add that, the university is always, including Gonzaga, Eastern, everyone around us is always really open to having these kinds of events. But really, it is about the public policies or the policies that universities put into place that also affects how we can reduce impaired driving and misuse by students and the health and mental health that affects that. Things like having events that always have alcohol, which is really hard not only on students, but it's really hard on those who are, or difficult on those who are in recovery or in treatment. It should not be the norm that alcohol is always included in every kind of celebration. Also policies like in the stadiums and at football games and who the sponsors are. We see billboards all over the community in Spokane about alcohol supporting the athletics at colleges. So there's policies that we can work on. I really feel that this power of the students who are going to talk to other students, and that the professor being able to support our students in having this as a project in their class. I think it's ways to integrate prevention in many, many ways at the university. It's up to each of us to make a difference. So.
As far as Texas Southern University, the event that we held was so powerful. Just the whole, how it was set up. Some administrators walked through and said, wow, this should be on the Tiger Walk. So that was just for this event. But we've also collaborated with Mothers Against Drunk Driving and other organizations bringing fentanyl awareness. And we have been so successful because our chair of our department, our dean, our whole school is big on us getting out into the community, collaborating with the community. Because again, the crises, the mental health crises, the substance abuse crises that we're experiencing impacts everybody, right? And the speakers who spoke with Travis's voice, all of them were talking about lived experiences. And so it really had an impact. So much so that we're planning on doing a larger awareness event, probably in the spring, to follow up, right? So again, it doesn't stop with the Communities Talk event. It's something that we must keep doing because the problem is still there. We need to address it. And again, I really thank SAMHSA and Communities Talk for initiating this so that it gives us a catalyst to from which we can begin the conversation and bring it to the university and into the community.
Yeah, I would say at SIUE, we had a lot of support as well, from administrators, faculty, staff, the students. And I actually recruited a lot of students to volunteer for the wellness event as well. So there were a lot of social work, public health, psychology students, many of them that needed volunteer hours and they felt passionate about the topic. And so it was a really good event to get a lot of support and assistance with making sure that it could be a success.
Yeah, I mean, it's certainly great to hear that you didn't experience like significant pushback. Maybe there's, hopefully a turning tide around just general stigma and discomfort with some of these topics, and a recognition that one, out of necessity, we have to be talking about these issues. So let me pose a question to Kelsey and Isaiah as the sort of student folks. What recommendations do you have for connecting with students and other groups on campus who would be willing to partner? So one, what was your sort of experience or lessons learned, and what would you recommend for others to engage with other components of the, different student body components or other groups on campus?
Well, at Texas Southern University, we're very collaborative on campus, and we have open communications with other department organizations, student organizations. So for us, the collaborative efforts are pretty seamless. Um, what we do mostly is make sure that we are serving our community and the interests in our community. So we don't ever get university pushback. We always give the go ahead, and we have supportive administrators and professors like Dr. Wilson, who encourages the students to push forward so that we can impact change in our community by creating programs or offering information and resources that can be disseminated throughout our community.
Yeah, I would say using connections that you already have to foster more connections, like throughout our project. We would be connected to someone, and then they would connect us to two other people, and then they would help connect us to more people. So I would say, like, using your connections to gain more connections. And then I would also say, if you're outside the university and you're looking to work with people within a university, students specifically, I think it's great to reach out to like student government organizations. I think it's great to reach out to like classes like marketing, public relations classes, such like that might have like in-class projects that they could use for like real world experience. So I think those would be some of the ways to connect with people on campus.
Thank you. So this probably be our last question to each of our speakers. What would you say is the biggest challenge that you faced? And think about that in the context of others who might be considering doing this. So maybe sort of like the challenge, and then what strategy was used to overcome the challenge. And we'll go whoever feels so compelled to talk first.
Well, this is Linda, and I would say that the biggest challenge I see is reaching enough folks and realizing that we don't have to wait for a tragedy to happen. There was a crash due to ice just a few days before this town hall, and the person who died in the crash was not seatbelted. And that is our first defense. And it was very tragic because the students knew the parent of this person. And I think that the challenge is for us not to wait for tragedy. I believe so strongly in prevention. I think that is the key, that we all need to know what we can do, how we can raise awareness, and be the one to say, I'll take the keys, or let's get you into treatment, or let's call the mental health hotline. Don't be afraid to go to the counseling office. I think that is incredibly important. And that is the biggest challenge for me. And I feel our prevention here in Washington is just trying to make it the norm that we do everything we can to treat substance misuse and addiction as we would any other medical condition or human tragedy that we need to help with.
I'll say this, one of the challenges that I can forecast is just remaining consistent with everything that's going on. Everyone has their own schedule, everyone has their own life, but remaining consistent and staying engaged, passing on information, keeping that torch lit and burning will be the key to maintaining that consistency and keep the messaging positive.
For us, I think to those universities or colleges or schools who wants to join the community talk, and the challenge there is where to get information resources for you to start. And one thing there that is probably a barrier that we can overcome is the stigma that is related to the topic of, like, for example, if a family or a son or a daughter with alcohol use disorder or a substance misuse or something like that, it's a bit difficult conversation because we did that community talk before with the community. So we try to be more a safe place to have this platform that they can reach out to their professor, to their schools, and to student organizations to have what you call this conversations in a safe place. For example, like partnering with student government organizations in the school or in the university level or even in the community, even the library. So creating this safe haven that is okay to talk to without stigmatizing the other people's experience with the topic. I think we have a lot of resources to overcome those potential barriers.
Yeah. Yeah, thank you so much. I recognize that we're coming up on time. I did just want to again thank each of you for sharing about your experience in the Communities Talk work, Communities Talks work. And I also wanted to note Michelle's comment around stigmatizing language. I think this is really important. And you were just speaking about this of, talking in ways to sort of break through the stigma, to create safe spaces for conversations. And, at SAMHSA, we have worked very hard to move our language forward in non-stigmatizing ways. So, substance use disorder, those types of terms. We have not yet been able to change our name and get rid of abuse in our name, but we are working in our funding announcements and other places to be very intentional with the language that we use. And I think this is important as we're convening communities together to really think about the human side of this and how words matter to individuals and how words can really get in the way of advancing policy. So Michelle, thank you so much for flagging that. If you are interested in free money, $750 as a stipend, this is the place. So we've provided information about getting connected into the Communities Talk on the next cycle. So please take advantage of the email, get registered, and be ready to take action when the cycle officially kicks off. Once again, thanks everybody for joining. Thank you so much to our presenters, and please keep doing all that you're doing every day to advance prevention work in communities. Thank you so much.
Thank you.
Thank you.